We're now going to talk through our paediatrics, and paediatrics refer to babies and children. The first question you've probably got is, how do we classify these individuals? Well, a baby is classed as 0 to 1 in age, and a child is classed as the age of 1 to the onset of puberty, and therefore an adult is classed as the onset of puberty onwards. Now for the child, we're not going to go and do any sort of check to work out if they've hit puberty or not. Instead, you just simply look at the child and think, do I think they've reached the onset of puberty, yes or no? If you class someone as a child when technically they're an adult, it's not the end of the world. You're just going to make a quick judgment call. Do I think they've hit the onset of puberty? So we're thinking around the age of sort of 11, 12, 13, that sort of age. So just to recap, baby 0 to 1, child 1 to the onset of puberty, and therefore our adult is the onset of puberty onwards. When it comes to our paediatric CPR, there are 3 key differences to remember. Difference number 1 is that if you're by yourself, you're going to do 1 minute of CPR before you call 999. So if I don't have a mobile phone myself and I have to go off to make that phone call, I'm going to deliver 1 minute of CPR before I go off and make that phone call. Now the reason for that is because in the baby and the child, they're unlikely to have had a cardiac arrest. The reason they're not breathing normally is unlikely to be a cardiac arrest by which their heart's kind of stopped working. Instead, it's much more likely to be some other respiratory problem, and therefore the CPR has a much better success rate or chance of working. So we're going to do 1 minute of CPR before we go off and make that phone call, because there's a good chance that the baby or the child might come round in that first minute of CPR, in which case we've kind of sorted the problem, which is great. We'd probably still call for an ambulance just to get them checked over, check that we haven't broken any ribs during the CPR, but at least you've kind of fixed the problem straight away. If you have someone with you, you can obviously get them to call 999 before that sort of 1 minute mark, but if you are by yourself and you have to go off to make that phone call, make sure you do 1 minute of CPR before you go off and make that phone call. Difference number 2 is that when you start that initial CPR sequence, you're going to start by doing 5 initial rescue breaths, followed by the usual routine of 30 compressions, 2 breaths, 30 compressions, 2 breaths. Just to recap, you're going to start your routine with 5 rescue breaths. You then do 30 compressions, 2 breaths, 30 compressions, 2 breaths in the usual fashion. The reason for doing this is twofold. Number 1, we said these individuals are likely to have a respiratory problem, and therefore these breaths are likely to have a good chance at clearing that respiratory problem. The second reason is because blood dissipates out of the baby and the child's blood supply very, very quickly, and so those 5 rescue breaths at the start of the routine are just going to give them a boost of oxygen into their system. So we do 5 rescue breaths and then our usual routine of 30 compressions to 2 breaths, 30 compressions to 2 breaths. Difference number 3 is we're going to alter the depth of the compressions and the size of the breaths. On the adult, we used 2 hands and went 1/3 of the body depth, and in terms of the breath, we did a full adult breath. On the child, we're still going to go 1/3 of the body depth on the compressions, but that's probably only around 4 to 5 centimeters, and to achieve that, most adults will only require 1 hand like so. Now this is just a guidance rule, so if you think you still need 2 hands to get that compression depth on the child, that's absolutely fine, but as a rough guidance, most people will only require 1 hand. In terms of the breaths, it's just half an adult breath, delivered in the same way that we did before. So we're going to pinch the nose, tilt the head back, half an adult breath. Like so, and you'll see the chest rise there. In terms of the baby, we're still going to go 1/3 of the body depth, but to achieve that, we only need 2 fingers. So it's going to look like this, 2 fingers, like so. In terms of the breaths, it's just a puff of the cheeks. It's just the air contained within the cheeks, so it'll look like this. Like so. Now, because your lips are so much larger than their facial features, you might find that you actually breathe through both their mouth and nose at the same time, and that's absolutely fine. It's just because, physically it's quite difficult to do because they've got such small facial features and your lips are quite large. You might find you breathe through both the mouth and nose. that's absolutely fine. If they're a bit larger, you might just breathe through the mouth, and once again, that's absolutely fine, okay? So 2 fingers for the compressions, puff of the cheeks for the breaths. A few other little things on the baby. When I come up to the baby, I can't go, hello, can you hear me? Can you open your eyes? So you can check for a response by playing with the ear or tickling the feet. When it comes to the CPR, notice when I was doing it, I also held the head just to stabilize the head slightly. You still want to tilt the head back slightly, but it's just a tiny little tilt. Generally, it only needs 1 finger. You don't want to over tilt it and yank it back, because everything's still soft and forming and you could actually cause some damage. So it's just a tiny little head tilt. The other important factor here is that if you do CPR on a baby, you should put them on a hard, flat surface, i.e. they should be on the floor or they should be on a very solid, stable table. On all individuals, whether it's the baby, the child or the adult, technically they should be on a hard, flat surface. You can't, for example, do CPR on someone in bed, because when you press down to do the compressions, their body just sinks into the mattress and you don't deliver effective compressions. Particularly on the baby though, important to have them on a hard, flat surface. A, so you can make sure those compressions work on the chest, but also B, it just keeps the alignment of the head, neck and spine in a much better position. Lots of mothers want to kind of cradle the baby in their arms and do the CPR that way, but that doesn't work too well. 1, because your arm might dip and the compressions might not work as well, but also it messes up the alignment of the head, neck and spine. So always keep them on a hard, flat surface like so. So just to recap, there are 3 key differences in our paediatric CPR. Difference number 1 is if you're by yourself, you're going to do 1 minute of CPR before you call 999 or 112. Difference number 2 is you're going to do 5 initial rescue breaths at the start of the routine, followed by the usual routine of 30 compressions, 2 breaths, 30 compressions, 2 breaths. Difference number 3 is you're going to alter the depth of the compressions and the size of the breaths. On the adult, we used 2 hands, went a third of the body depth, and for the breath, we did a full adult breath. On the child, we're just going 1 hand, a third of the body depth, and the breath is just half an adult breath. On the baby, we're just going with 2 fingers, a third of the body depth, and the breath is just a puff of the cheeks. And that's your paediatric CPR.